Good evening. I am calling the Social Services Committee to order for our February meeting. Jessica, can you call the roll, please? Here. 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 Thank you. And
Here.
Wonderful. With the quorum present, we will move to our next item, which is approval of the meeting minutes. I need a second. The meeting minutes from the November meeting.
I'll make the motion.
Motion, thanks, Ken. I need a motion now. I need a second.
Second.
Thank you, Kathy. Jessica, can you call the? Oh,
No, we can do a vote.
oh, that's right. We can do a voice vote. Are there any abstentions or opposition? Everybody in favor? Aye.
Aye.
Great. We have multiple times for public comment, but we pause at the beginning here for public comment. Is there anybody in the queue?
I have one comment. We have one comment.
Hi, can you hear me?
Yes,
Yes,
Anne,
we
we
can.
can.
Hi, this is Anne Brown. I'm the Development Director at Pure Services, and I just want to thank you for all the work that you are doing and invite you to continue prioritizing mental health and substance use disorders among the safety net services that you are considering. That's all.
Thank you, Anne. And do we have somebody else? Nope, that wasn't okay. All right. Then we move to our next agenda item, which is 2024 Public Service Funding Priorities.
So, I prepared a slide deck, to review not only the city and health department goals, but also, participants served so far, since our restructuring and the types of services. The goal of establishing priorities is not to evaluate programs, but, with this new application year opening up, if we had, let's say, 5 new applicants for art services in schools, how would that fit into our current funding goals? Or if we had, let's say, 5 new applicants for homeless services, how would we want to consider those applicants in our sort of broader funding priorities? So our first step is to briefly go over the city council goals and the and so the city council goals have 5 broad categories. Our funding does not fit into those categories directly, but support for public services certainly does provide assistance to vulnerable community members. Council's metric for that is reduction in visits to emergency services, reduction to emergency room visits. Our metrics, we will not be measuring emergency room visits in any of our programs or services, but things to consider. Council is also dedicated to establishing a 5th ward health. It is very exciting. We do provide services for and then there has been much discussion about wraparound services. That's still very much an ongoing conversation. We'll present more information about wraparound services in the community and what that could look like as we have that information. But right now, it's still very much in the planning phase. The city's E-Plan also established certain community priorities. And those those are the advancement of health and racial equity, and improved mental and emotional well-being for residents. Again, our funding does not, or the programs we support don't directly fit into, but of course support these. So let's take a look at the participants served since our allocation restructure in the 2021 program year. We are still serving our target population of low to moderate income residents. We are serving a majority of Black residents. There's one little sliver between Asian and white, and that is for our Native Hawaiian or other Islanders, and our Native American, or those who identify as Alaskan. And then we're looking at the annual, or the average age of participants. The light blue bar is for the 21 and 22 program years, so it's 2 years combined. The darker bar is for 23. I'd like to say that while it appears that we've served more seniors in 21 and 22, and more children in 23, that's actually not the case. It's a little bit, because we started to, fund Connections Youth Program, a separate program for Infant Welfare Society. Our youth pool, our children under 18 have increased. Again, it's just because we included other programs, which speaks to how establishing priorities could affect potential applicants moving forward into the 25 and 20 years. How we can impact. We also looked at the programs by the participants they target, and they're broken down into house residents, our opportunity youth, our residents with documented disabilities, individuals and families, primarily low and moderate income individuals and families, seniors, and residents fleeing domestic. I just want to add, I think one of the things we're target of the program, is targeting seniors. So, this next slide also lists the target participants, but here I broke out the specific agencies, or I can go into more detail with the programs that primarily serve that population. To Marion's point, there is a lot of overlap. So Family Focus, as an example, is right now under Opportunity Youth. They do a lot of work with youth, but they also run grandparents raising grandchildren. When we look at the number of seniors our program here, Family Focus adds to those numbers. The same is true with YOU. The primary services are we also looked at categories that are programmed. So it can be broken down to basic needs. These are our food and programs, patient case management, and so on. We would anticipate with for safety net that we would have a broader range of categories.
Can I ask a question on that? Are you saying that, that the money we provide goes directly to housing, or is it to an organization that serves basic needs, or?
Thank you.
You know what I mean? Like, is it
Yeah, it is to the organization.
to the organization? Okay.
So under basic needs, we do have those
Gotcha.
Community Connections programs, Interfaith Action with their emergency overnight shelter, Meals on Wheels as a food provider. WCA, because while they also provide
Right.
counseling and money management and youth programs, the main focus is. So I did talk quickly, so please jump in if there are. Our current application guidelines do look at the management program and then our safety net program. So the main guidelines under case management now include the creation of service plans that are individually focused and driven by the number of connections, case sizes, are looking at the number of referrals that are provided, the number of actual connections. And then we're also looking, I call them graduation rates. We look at exits and then we break those exits into, where we have sort of maybe more room for interpretation, are safety net services. So right now, the metrics around safety net include the hours of service provided and or the number of services. This would be like the number of meals provided or the number of tutoring hours. So to sort of wrap up this overview, the committee could look at the population to prioritize, whether it was families or unhoused residents, or that the goal has always been to assist with recovery from the pandemic. Once community is stabilized from the pandemic, the goal is our equity lens, so helping residents thrive in the community or using funds and resources to sort of support communities that have been marginalized or historically underserved. We know that our programs support sort of a broad range of age groups, and we're of targeting low moderate income residents, but really it's in the types of services or in the population served that we could build some priorities. And this is, there is nothing for action tonight, although if is welcome to vote, but it could be vote in March. Or asking questions, or certainly direct staff to more information. Okay, that being said, we have a timeline to open up our new grant application process. Hopefully that's going to happen this summer. Historically, the grants open for agencies to apply in July. The city staff, I have meetings with applicants to provide an overview. So in this first quarter, we're reviewing the goals and priorities for our next few meetings prior to the application. Look at a score tool or rubric.
For priorities, are we talking just priorities for safety net, or are we talking priorities for, we have 3 categories, if you will. So for all of them, for just the safety net, like,
That's a great point. It's technically be for the funding, but it could be whatever the committee agrees to. Those priorities would certainly carry over into mental health provider program. In the safety net, part of the discussion, the question here is, we can come back to the evaluation, integrate priorities or not. Safety net is where there's the most opportunity to try an application so that agencies understand where the committee is going direction-wise, as well as understand how things are going to be. Especially in a case where we may have requests that go over or well over funding that is.
Right.
How are we gonna approach evaluating one program against another?
And safety net's always, if we can go back to that slide, I do feel that safety net is always sort of the hardest in the sense that it is, like, how do you, tutoring hours versus meals, like, both important, but it is hard to sort of like compare.
They're difficult conversations, which is why it's easier to start having it earlier. By the time we get to looking at programs, pretty much every program that comes here,
It's all good.
yeah, really beneficial. Also, if I may say, a good opportunity to explore community needs or any gaps in services.
Yeah.
As committee members are seeing them. Gathering that information is always an ongoing process, and the city will, launch our community needs assessment for CDBG funding over the summer and fall, and we'll share that information as we have it. We were able to find some information around student engagement. So the District 65 recently released their equity progress and report. The good news is it shows that attendance is up and behavior incidences are down, but for third and fourth graders and for fifth and eighth graders, we know that our Black students report the highest percent of feeling like they don't belong at all or belong a little in school. And our Latino students, again, third and fourth graders, and then fifth and eighth, report the highest percentage of feeling not at all or slightly eager to participate. So when you look at our youth programs, right now they're listed as education, but there is certainly a component of engagement when we're talking about books and review. Those programs, we can see they're supporting a group that use that support in our community. But again, one of the many reasons this is a public meeting and a meeting staffed by, not staffed, but a meeting that has the city can hear. Any gaps or community areas?
So it
We're here, well, yeah, and like, we think we're doing good work. I think we're covering a lot of bases.
So if I'm hearing correctly here, so the city CBDG review, or the review for that, will be taking place starting the summer, running to the end of the year, basically?
Well,
So is it gonna overlap with our receiving applications and then also, and then our deliberations around allocating the small amount of money in my mind for, that what's happening?
it's most likely not gonna be completed as early as you would want,
Yeah,
because it's part of the 5-year consolidated plan effort, and that plan is due in November.
5-year plan, you said?
Yeah,
Oh.
and that's for CDBG only, it's all the federal funds that, the city receives. So, we may have some initial information. Timeline, it's probably shifted a little bit, like, Jessica needs to get going and have everything finalized pretty much by June for this. On track for your schedule, application, so that data is not gonna be, most likely won't be finalized.
I think a problem it presents for the applicants for the organizations is that, they're gonna have to project, program their needs to us, to the city, for the funding, but it may not be aligned with, what the CDBG study comes up with, right? I mean,
Well, yeah, so I have to say, looking back
I'm just
at
looking
our
for
last-
like, where is, what's the kind of the dissonance that might take place, and if we get into, I'm remembering a year and a half ago, that December meeting, which never ended, and we had, different ones of us on the committee weighed in heavily on different program priorities, right? And, we were sort of, I felt, at least as a committee member, was operating a little bit in a vacuum, because I don't have the sense of what's the overall needs, that's all. Maybe I'm speaking to my inability to like weigh all of that, but I'm looking at, we're gonna have some
No
issues.
matter what.
Yeah.
Yeah,
And that is very fair.
yeah.
CDBG primarily focuses on areas including creating livable communities. We know that affordable is a huge priority,
Yeah,
and to provide some sense of, not comfort, but like, you're not completely in the dark. We do ask agencies and applicants to report quarterly with the challenges they're seeing in the community, the barriers. We've heard consistently that a lack of affordable housing, and lack of affordable housing is a big challenge, stable housing is a huge need. We've heard that workforce development and jobs that do pay a living wage, that's a big challenge. There are other city programs working to address housing. Other challenges that agencies reported are a little bit more diverse and spread out. Some participants have, with procuring, childcare is often a need, affordable childcare is a big need. But I really do think that the focus of this, goal of this group is to provide that sort of safety net, to support the agencies that we is serving sort of a broad range of Evanston residents, covering many needs. That's what our community members.
but,
I would be surprised if the community needs assessment builds age discrepancies. Right, one of the big issues that we.
As part of the process to do community needs assessment, and we talk to community members, we talk to residents, we talk to organizations and agencies, some of them being funding, so that continuous conversation, like, there shouldn't be a very large discrepancy that the agencies that we currently work with that are sharing regularly, and what this committee constantly hears, and what we establish as part of it.
One thing I'll flag, hospitals have to do a community needs assessment every year, so we might wanna pull, and they vary, some are stronger than others, I don't know, but we might wanna pull the Evanston Hospital community needs assessment, since we'll have those sooner, and see how
good point.
robust they are. See if there's anything that pops that maybe we're not talking about.
Especially if they're if they're not,
Yes, they do,
right.
but the depth varies.
Yep. Another question I have is, do you have any sense as staff now that of there are new or different organizations that are likely to come forward than the list that we've funded these last 2 years? Do you have any sense of there's new applicants, new organizations that are providing any, any piece of these?
New services,
Or new services, yeah.
given
It's more of an,
an immigrant.
it's a-
Good question.
yeah.
And it's a challenging one. There are agencies, I can think of, several agencies that have applied in the past, that have been funded in the past, that for whatever reason, over my tenure in this role, have changed from our funding. LAF, Legal Assistance, the Legal Assistance Foundation, we used to fund them. Open communities, there are some we've funded in the past that, don't really match our model under the reallocation structure. So Shore Community Services was one. They provide services, with documented disability. The residents are benefit plans for, it's hard for city funding to get an increase in any emergent demand for services. Learning Bridge has been a recipient over the years, so like,
Yeah,
yes and
it
no.
just raises, so there could be increased competition for this pot of money that we look at, yeah.
I think that looking at it from a perspective of kind of, there will be, kind of help face that situation, if, like, we may not see it, but having the committee being prepared for that eventuality, so that you will have an understanding of how, in the abstract, you want to prioritize the money, so that when it comes time to review applications, on an agency versus agency.
Right, it is much easier in the abstract to sort of prioritize than applications, and you're actively saying no to one and yes to another. I want to hear from other folks. One other thing I want to just put out there is, I do think from a basic policy, giving everybody a lot of a little bit of funding is sometimes worse than giving 5 groups what they asked for, or close to what they asked for. So I would like to avoid giving everybody half of what they asked for. That's sort of as hard as it is.
As staff, I would, second that, especially from a perspective of the reporting and the compliance that big burden for the small amount.
Actually, an analysis of the threshold, like,
Makes sense.
Yeah, and then they have the up with, yeah.
$30, what did you say?
30,000.
Is the threshold where it is helpful, 30 and above is,
yeah.
Yeah,
very
okay,
well.
that makes sense.
yeah.
So then, should a focus be on diversity of services? So family focus kind of fits into multiple categories. The money could go a little bit longer as opposed to smaller organizations.
It is one thought. One of the things that I hope to bring as we analyze who else is funding, or where else are funds coming from, because,
Yep.
there are some agencies that state and federal funds. Yeah.
Particular niche.
I think that's another thing that we should, if there's a different funder,
The need,
yeah, that's meeting the need
then we can
for that safety net,
concentrate
yeah.
on those that are more in need of funds that we have.
The Evanston focus, I think, will be. Any thoughts on the action, Amanda, I keep looking at you like, this,
I know, I don't know. I don't know what to say. I feel like it is hard to say. I mean, I feel like what you shared about District 65 is very compelling. About, new immigrants is compelling for me. But I don't know. I don't have a strong feeling at this point, but I don't know what others think.
how did we prioritize the safety net funding last time? We say was our,
So there was nothing,
that,
nothing officially, nothing came to vote. There was discussion about like the hierarchy of needs and
mm-hmm.
the basic needs being here with me.
Yeah, yeah.
Way back when.
We kind of did the mental health piece, I think,
That
right?
was the support service, right?
Yes,
Yeah.
yes. Well, and that was, so we spent a lot of time talking about an agency representative. It was right through the pandemic, through 2020. And mental health was the most identified.
Mm-hmm.
Also, that would fall under the support services category?
Yep. We had a clear priority for that one. I'm actually wondering why, I guess it's because it was substance use prevention, that's why peer services was in safety net versus
Yeah.
prevention versus treatment.
And they are treatment, they are treatment.
What do others think about priorities, or, it's really tough, but.
I know we had issues, or we heard from agencies, their issues of their ability to provide services as retaining staff during, and again, that was the pandemic this year. It is, new arrivals and refugees. I'm curious to see how they feel that will change for them in the next 2 years versus, so I don't think the pandemic is ever gonna be over. It just keeps coming back in a new form. How that focus is going to change for many of these agencies that will now need to have staff that is compatible to the people that they are serving. I think it was a major challenge, especially with the daycares retaining people, the safety nets being able to continue to see people. So it's gonna be a big challenge. But I don't know, it was,
The workforce development piece of it.
yeah,
Yeah.
yeah.
It's interesting we didn't have any workforce development.
But that's one of the city's focuses, correct?
Yeah.
In all aspects, from health all the way down to sustainability, whether it's youth or, housing insecure.
Corporate development, yeah,
Workforce development.
program. There's a team that has been started,
There's
so that could
some
be,
city funding
right,
for
it's
that.
just not lending in front of this committee,
Got it.
specifically, potentially, as a request.
Just get like a little bit of, they have a PowerPoint on their work or something that we could
I
see.
can absolutely,
No need to create anything new.
No,
I just
yeah.
assume they have.
they do. Yeah, we were reviewing it today.
That way we could feel comfortable knowing. Yeah.
One of the trends that, we saw is that our service, our Hispanic population is gone up. I know it's not just well, but in the 21 and 22 program, the combined programs for 8% of, that rose to 10%. Not sure if that's because programs opened up a little bit, or because more, people who identify, but it's definitely on our radar to, agencies that are providing services
Or any of the other
or
languages.
any of the.
That was a big issue,
Mhm.
whether it was French or some of the African languages, or,
Anne has said that the peer services there is treatment, it isn't prevention. Thank you, Anne. Did I get that all right? It's far.
okay, sorry, Ann.
So, the question about priorities and how we're gonna, I have a few thoughts on that. One is I'm hoping that in our early discussion, we can, as a committee, come down to, I'm gonna be arbitrary, 3 to 5 filters that we wanna place on these requests. It just, that's my thought anyway. Second thought is that I look at this as we have very limited city money to address these really critical issues. And so I'm a little bit, I would fall more on trying to spread it around versus, concentrate it. I just feel like I don't wanna, just say it's an equity thing, but it's about, the needs are great, the money is little, and we've got these very hardworking organizations trying to address, the most vulnerable, the most needy, situations in our community. And then another issue for me is that some of these agencies are very large, and that our contribution is really quite small, or, into what is a million or multi-million-dollar budgets, right? And that weighs on, for me too, is when I look at an organization that, I don't recall that I'm in the right number range, but if they're in a $300,000 budget versus a $3 million, I would tend to see that the money is more needed if we agree that organization is really addressing, the need, that they've identified and that they're working. So I don't know what priorities to, which, what to make number 1 and what to make number 10, but those are some of the screens that I think about, is like, where is our money, have an impact, but also how does it really reach all of the communities of need in this community, yeah.
what you said about equity, though. I think that's very important, and are we going to look at agencies that are coming in with new advocacy and addressing equity issues? Hopefully, I don't know how we would do that, I don't know.
Sorry to cut in there, but
Mhm.
we struggled with some of that last time. I thought
Mhm.
there were some new organizations that came to our attention. That was my first meeting, so my first.
Yeah,
So
I
for me, it
remember
was,
this.
but I was hearing from other members of the committee that, here's a I think it was a counseling or,
Yeah.
that was reaching, parts of our community that are just not reached by, like the long term or the big anyway, so I think that's important that we hear that and we find out what is, and they're gonna look less stable
Mhm.
as an organization than somebody that's been around 10, 20 years and has built a budget and has a reputation within the world and within the government funding world, so, again, I don't know how you sort through all of that, but, I think those are some of the, for me, this is about Evanston money. It's very limited. How do we reach the pockets of that?
To summarize, would it be helpful, we try to, agencies, or programs apply with their program budget. And we also review their agency budgets.
That's very important.
And I try to present that information. Sometimes for agencies, their program budget is their agency, like,
Right.
that's it.
This is it.
But I can certainly, call that out more in the application.
Yeah, I recall that, and I thought that was very important.
Right.
Yeah, and I think it's really important that we want both, right? Like, if
Yes.
the program won't exist
Yes.
without this city funding,
Right.
as an applicant, we need to fully appreciate that, especially if it's an existing program. Because I think some agencies submitted just their full budget. I remember looking at this, like, this is like 0.5%, like,
Yeah.
sorry, like, you're gonna probably be okay. And then they came back later and were like, oh, no, this is like, this is a much bigger chunk of the program, and
Yep.
you have to make it really clear.
Yep.
And I think this is my understanding, I was on the committee in the last iteration, but the last iteration of the committee, the mental health committee preferred that the city funding only make up like a certain portion of the program funding, and so they wanted to make it, applicants wanted to make it sort of look, they had diverse funding streams, and it would be okay if the city was there or wasn't there, and I think generally speaking, we've sort of taken a different approach, which is, we actually wanna know if we are your largest funder, so we can fully appreciate
Right.
what a different decision means for you.
For you, yeah.
So I think that's important to say, I don't know how we say it exactly, but just, but I don't know how we say, like, when I'm looking at these various categories, I can't tell you which one of these, like, I mean, every study, everything I'm reading now is like, our kids are having so many challenges.
Yeah.
Whether it's in education, or it's in mental health, or it's in substance use, or it's, you know, like, there's,
Homelessness.
and parents, and basic needs, and food, I mean, like, I don't know how you know, prioritize that. I almost think we have, like,
Do we need to?
to Ken's point, I think those screening questions of, and maybe more, the priorities are programs that meet the needs of the community that wouldn't otherwise exist. There isn't alternative funding, that are serving Evanston residents. And the impact, I think that impact and understanding, like, those outcomes is really those are my,
And that might also allow us to have a diverse set of services, you know,
Yeah.
that might meet that criteria, which is
Old
like
and new.
everyone's in favor of, because they're all important.
Do we ever consider if the organization is Evanston-based, like foundationally?
it's part of, like, or maybe it's just what they tell us, you know, like, I mean, everyone who, like, anybody who's like, I've been in Evanston for 100 years, they let us know, I think.
So, in the operations performance report, we do, have information about the total population served, and then Evanston residents, and I try to include that perspective. So, you know, like,
Right.
lunch and breakfast, I
Right.
think, 100% Evanston
Mhm.
residents, whereas
Connection to the
most
home.
of the centers, yeah.
Different.
A lot of these are regional or.
Right. Because
Yeah.
Connection's
At
regional.
least they,
It's like Cook,
yeah.
Yeah,
Yes.
but it's,
but it's
the program
out
is
here.
Evans, yeah.
Yeah.
Right.
And that's, I think,
The
sort of
program.
also like the thing where it's, can be unique, right?
Yep.
Where some also have multiple locations, and we're funding
That,
the
the
Evanston
some
location.
location.
Right? The other thing, and I don't remember where this landed, but I think it was Councilmember Burns, and it wasn't, and I'm misremembering, but the idea of helping members of the community apply to services they are eligible. that can be incredibly impactful, but there's not always an easy
Right.
entry point to all of the entry points. So I would say that is something I'd be really interested in because, you know, I suspect a lot of the members we're surveying could be eligible for TANF, for Medicaid, for child care assistance, for things that are gonna have a much bigger impact on their well-being than just I'm gonna use books and breakfast, just 'cause, but like, than just books and breakfast. Like, we actually want to
Mm-hmm.
help them with all of that.
Would that come under case management?
So what I don't know is it could actually be a nice tie-in, like,
Yeah.
for the case management folks to help. Maybe case management, maybe,
I thought they had to be in case management services to get the safety net.
that was support services.
Is it? Am I mixing up the
So, safety net services can be a gateway, and I'm gonna use North Shore Senior Center. They do benefits enrollment, but they don't necessarily provide longer term. But there is this expectation that case management providers are enrolling
Yeah.
households in.
But you can get,
Just to answer your question, yes, case manager are referring for support, like, physical service. Has to be in.
That's correct,
Yeah, okay.
That's-
So I
They
was like
try to
mixing
connect,
it. Yeah.
but yes, the case managers are the one referring mental health provider
Yeah.
guidelines, chocolate.
Yeah.
and safety net can refer over to care, or to the
Navigator.
navigators, but I think that entry point of application assistance, I would be interested in because it could meet some of those basic needs and it can be a tough nut to crack.
I think that kind of goes back to that conversation around background service,
Mm-hmm.
but is finalized by the time.
And trauma services, I guess most of the trauma services would go under safety net?
When you say trauma services,
Child abuse, violence, secondary victims, witnesses, things like that.
well, so that is complicated. The city has a, charge to, anyone who involvement with the police, if there's trauma, as it could go, and while they are city, their role to work with victims, advocate on their behalf, and line up any services. They don't do long-term case management, but they do refer. The city also has our this team does do longer case management.
No, is that what's going to be offered under the health department, or no?
Yes, those
It's gonna be under the health department. Umbrella, okay.
Yes, and we do, our application does, the agency is providing like trauma informed care, which I realize isn't exactly the point, but when we're looking at services provided, those would be, things when we're talking about trauma, it's really connections and, WCA is
Right.
only domestic violence.
And you would probably see some potential within the support services mental health funding too, right? I mean, I would think if they're in case management. I suspect it.
Ideas around this voting, but I wanted to kind of lend my support to what you were saying, Mary, and you too, about, offering a bigger reward versus, which is the opposite of kind of how I was thinking about it in the past. I was thinking like, oh, it'd be better to give a little to everyone, but I am sort of drawn to that, the piece of all the administrative stuff that I know these agencies have to do. I do want to like avoid that for people if the money isn't gonna truly be, worth it, and I feel like that's the piece for me. Like, I would like, in fact, like, to give a little bit to everyone, but I do think about that administrative piece and what a burden that is for agencies, and so I'm a little bit more in favor of doing bigger awards for maybe fewer than, maybe that's like some, up to that criteria, I don't know, but.
Like, what can your what, your program, what is I don't wanna say the scope, but the capacity of your program, your reach, and I'm gonna say, it's almost like, I'd rather give you 50,000 to have a really great impact
Right.
than 20,000 to have like a small,
Yeah, and you have all this work, you have
And
just
you have
as
all
much
this work.
and not as great of an impact, yeah.
yeah.
Is there a way to communicate that also? Say that you would expect a minimum grant to be 30,000, let's say, and then just, I don't know, formulate the question about it. Well, I guess it's, I should go back and look at the application, but it's, basically the question is, what would this money do for you and your
Yeah.
organization? If you,
Yeah.
so, you know, like, I don't wanna be coarse about it, but it's like, if I'm applying money, I need to be upfront with, this is the $30,000 or $50,000 grant with.
And I think that the absence of it too, you know, I mean, and maybe you get there the same way, but like, what does that mean? Especially, I guess if you're an existing an existing grantee reapplying, making it clear what that absence would mean for the community.
But at some point, and guess I'm playing devil's advocate, I'm sorry. So I apologize in advance. Some of the money we gave out went to staffing, but it went to upper staffing versus direct service staffing. So how do we look at that?
So I can ask agencies to provide that. I do know that, or I can think of programs, that have applied city funds directly to like a staff member, and that was how they showed an increase in
Essentially hire a new person.
A new direct service person.
a new direct service person, specifically to serve as those agencies that are, and it is a little bit more, I think that is under this new way of reviewing, boards. But, like, Carol Fry mentioned, it's also important for agencies what, loss of funding. They're back.
I think to this point as well, there could potentially be is used for a man because that can be covered for restricted funding and solely used for that. So our funding may be slightly more flexible and allows them to have funding to keep that team going.
Yeah.
So there's that nuance to, not that it's applicable everywhere, but mine as well. Where, that's where the argument around what happens if you don't have.
Well, that's helpful. I mean, I think that's where, and maybe Jessica, in your meetings with them, sort of explaining, like, that piece is important to the committee. I also think there's some, I'm trying to remember, but like, there's somewhere, the bulk of sort of the direct services are volunteers, and so it is just like, it's the organizer, which
That's
might,
doing it all.
that might
I
look
got it.
like an upper staff member, but it's like, well, really, they're doing all the volunteer outreach, they're doing all these things, but their title might not look as direct service, because the volunteers are the direct service. Like, I mean, tutoring could fall under that in certain instances.
Good.
Yeah. I mean, depending on the model. And Meals on Wheels is like, or not, I don't know if that, but there are somewhere it's a lot of volunteers, but you've gotta, yeah.
Okay.
So we've decided, we have principles of how we wanna structure the grants, but not necessarily. I do wanna say though, that the equity lens, the serving low and moderate need members, you know, all of those items, I think, are still, at least for me, very still consistent. Okay. So it's just that in the safety net, I don't think we have a service category priority.
On that, I will say that we expected this, the committee, we're just, so we also don't necessarily have. But we'll be able to come back with tools.
Yes.
Bob, I didn't know if you had, you were like poised to say something or.
Yeah, Renee?
Weird. Oh, no, okay.
No, I'm just having a hard time with it.
Yeah.
I know the ultimate goal of Evanston is to keep the Evanston residents here, excuse me, to keep the people that are living here with an Evanston address here, I'm gonna say it that way. But it seems to be failing miserably. So that's bothering me. Like, we have these services here that are supposed to keep the people with an address, an Evanston address here. That's not working. I'm having a hard time buying into the agencies, or I don't know if they're doing the right thing with the money, or when they get the money, maybe the people that are there aren't the right folks, you know, like case management team. I don't know. But I know that the underserved community is, lessening by that we can look at it. So it's bothering me. What are you really doing with the money? And, if you've never been in the case management field, maybe you have a hard time grasping clients, like the actual clientele that actually come into these places. Most of it is back rent, I need a place to stay.
Yeah.
Or I'm about to be evicted. That's a lot of it. I don't have any clothes, because I'm about to get evicted, or my kids don't have any clothes, I don't have a job right now. It's an ongoing thing. That right there will make a person move. So that's what's happening. So when you go to Connection, that's your schmeal, because that's the truth. Either we helped you 2 years ago or a year ago. What are you doing? Are you recording?
No, I'm taking a picture.
Oh, okay.
What's happening over there?
I know what he was doing over there, wasn't it?
That's what I did.
Oh, okay, thank you, I didn't know that.
Right, I didn't
I
even.
thought you was an angry resident.
No, just a reporter.
I stay on 10, y'all, excuse me. I don't know, I just feel like it's not working, like, and I hate to be the, like, the negative Nelly and all that. It's not that, I'm just getting to reality of it.
And we need this, like.
Yeah, I don't want us all to be on the
Yeah,
this is
Yeah,
a better
it's just hard to
discussion,
hear.
yeah.
I know it's hard for some people to hear, some people don't wanna hear it. Some people can ignore it and say, well, let's just focus on this here. But this here is the people that are serving, or the folks here are serving our underserved community. And what they're doing is not working. I'm having a problem with that, a real hard time. I think Connections is doing the best they can. Do I think the admin or the regime over there is the best? Absolutely, 100%. I don't even know. But I understand that the case managers do what they can. I do understand that. So when you do what you can, still not good enough. And then we can go over to Hilda's place, part of Connections. You know, they always say it's not, it is. And then you have people going in and out because that's the place to go, which I like. We need that place to go here in Evansville for folks. It's repeat offenders, I like to call them, the repeat people, just over and over and over again. Some of them don't want the help. I've learned that dealing with, homeless or housing insecure folks. Some of them just like living like that. That's how they wanna be. It's 20 years of doing it, that's all they know. But most of them are not like that. And then we have the barriers with these people that aren't like that to even get the services. We're putting this huge barrier on them. They gotta see us 5 times before we can help. We gotta this, that, and the third. If they're here in my face, that means I am to assume they have nothing. They don't have anything, or you wouldn't be here talking to them. So I think it's hard for the staff members to get out of the numbers part of it and stop forcing, so this is forced, our folks that have the address of, an Evanston address to do something 5 times before they receive help. We're not, it's not a doggy, it's not doggy school. I mean, we're not going to obedience class here. So now there's another barrier to even get to the money that you might get. We haven't even started on the application part yet. No. We're just talking about seeing you 5 times to talk about, I don't know, how much more money you need and why I keep coming in here 5, 6 times to talk about the same thing when now I'm more of a month behind.
Completely evicted.
2 months behind, 3. So now let's set up the process to get me to the place, so now I'm evicted for real now. From there, oh, well, now we can't do this service, we have to do this service over here. That's not keeping me in Evanston. And if it is keeping me in Evanston, now I'm underneath the underserved, like I'm, you know, like I'm outside, you know what I'm saying? And I just have a real hard time. No feelings against Moran Center, we all know what they do. North Church Senior Center, we leave them alone, leave seniors alone. Substance use prevention, I don't know, I've never seen it. So, and the basic needs, Connections, Interfaith, Meals on Wheels, YW, I have a hard time with YWCA. Infant Welfare Society, good. Books and breakfast, I have a hard time with that. Family Focus, we already know what they do. YOU, we know what they do. So when you brought up these multi-million-dollar budget Connections, but you coming in here asking for $30,000 for what? Like, what are you really using that small amount of money for? And it bothers me when they come in with numbers that are not real. They're just not real. I'm sorry. If you're helping 160 people in a month, oh yeah, and 20% of them got a service or whatever. No, they actually really didn't. 20% of those people probably had those 5 conversations that they had to have leading up to the application that probably never made it through. Because one, they don't have an ID. Sometimes they can't get the birth certificate or a social security card, whatever that identification barrier is. Don't have a utility bill, so how am I gonna prove I stay here? I stay over there. I just can't prove it.
I stay at Mason Park.
I can't prove it. Well, how are you staying there? Because Miss Ann said I could stay downstairs. Yeah. Hey, can you get Miss Ann to give you a lease? Miss Ann is not gonna give me a lease. I mean, it's really bothering me, and I'm just having a hard time with it. And then I was like, well, am I the right fit for the committee? Have that go through my mind. And I'm just being real, because I can't sit here and be fake and phony. Like, I can't do it. Like, we're just not doing the right thing here. This whole thing, the Evanston residents are not staying here. So I just feel like we need to just press a reset button with, the application process, or even coming to Jessica with this nonsense. You know what I'm saying? And it just make it look good. And I'm telling you, the center of concern, and I told her this when, I'm saying she, but not just you, told the center of concern no to that money. I was so happy, and I worked there. I was like, that's what y'all get. You know, because you're not, what mental health services were they doing? I'm the case manager, and I was like, and I just sat there when we were going over it in our meeting, and I said, what mental health services? Like, I literally had to say that. But you coming over here to ask for some money for mental health services that you're not giving my clients? Oh, I was so happy when they said no. Good for you. Now, regroup yourself and go somewhere else and get that money. And they never did get it. You know why? Because they didn't need it. You wanted that to put in your pot of, or whatever, I don't know what you did with it, but they still never, they never, ever got a mental health service. They just wanted the case managers to provide a mental health piece, which is, let's talk about a plan for tomorrow, the safety plan for today. Let's talk about a budget. Let's talk about managing money. Let's talk about childcare. Let's talk about parenting skills. I mean, my parenting skills fine if my kids was all right, and they still eat, they're alive, they're fed, they got clothes on their back. A lot of services are, I'm telling you, sure as my name is Renee Phillips, a lot of it is just a big farce. Yes. I'm having a hard time giving money to anybody at this point. And those probably thought I was kind of cursed with the YWCA young person that came here. I wasn't being cursed. I wanted her to say where the money was coming from. And I was like, just say it, but she didn't know. And you brought it to my attention, she probably really didn't. Then I felt a little bad, only this much. Because why they send this lady in here with not the proper information? And I'm sitting here like, I know where this money is going. Then she had to say it. Then she eventually had to kind of, well, I guess it is going here. No, it's going to your director or your supervisor. So like you said, maybe increase her pay so the other money can go to the case managers, which I'm sure it didn't. You're just increasing your pay. What are you going to do with that money? Decrease your pay to do what? Sit in your office, I guess, and supervise the rest of the case managers? So if you're providing a direct service, which you say you are, director or supervisor, what did you do? What did you do with the $30,000 or whatever you got from the city of Evanston? What did you do with it? Did you give it to those poor women and those children? No, you didn't. You know why? Because that's just not what they do. I work there, I know. So I'm bringing in donations for laundry detergent, this, that, and the third. You don't have no money for no laundry detergent? So I just sent an email out to all my friends, text or email. We got about 50 different kinds of whatever, laundry detergent in less than 24 hours. Renee, how did you do that? All I did was ask. All I did was say, hey, y'all, I need this help. I need y'all to come over here and just support your girl as to why this is what I need, and it was done. I'm trying to figure out why the Y needed me to do that. Where's that 30,000 or whatever y'all got from Evanston to buy that laundry detergent? Where did it go? You should not need anyone to give your client that we're serving laundry detergent because you can't afford to get it, because you ran out of funds. Are you mislocating these funds? Are you misusing them? If you're giving out 2 pies per person, we don't use 2 pies for a big large bowl. I'm putting 4 of them in there, and then now my clothes still dirty.
I know, I'm like, I only one.
What are you doing? You offering piecing up this tie. I was like blown away. And I was like, do y'all have bleach? And they were like, no, they won't give us bleach. Well, what about the dryer sheets? No, we're not allowed to use dryer sheets. Why? Because they can't afford it. I'm not making any of this up. But they don't want you guys, us, to know this part of it. This is the part part that they don't want us to know about. It's bothering me like times a million.
I mean, it's interesting, I was on a panel today from a work perspective, and a lot of states are doing, in pilots, I mean, we have one on guaranteed income, or like direct services to residents, because all of these other efforts to address all of these social determinants of health, health-related social needs, I mean, you can call them basic needs, I mean, you call them whatever you wanna call them, but essentially direct support to residents or to individuals, to people, can be more beneficial than sort of all these other programs at times. And I don't know if maybe I mean, obviously we would need somebody to help administer it, but is there some way where we ask for those direct services?
We should just literally ask them, where is the money
Yes,
going?
that's it, yes.
Split it up and tell me where it's going. I mean, like, literally. And then maybe we could do a check-in in a few months, and see how that money's doing for you. How is that money helping, whatever.
It really
Yes,
does.
a lot of people do it. A lot of, especially like with family farm, if they're strictly one-off donations.
Mhm.
And in 3 months, they ask, hey, how's it helping? You know, what are you doing for the clients? Are you doing this? Are you doing that? And since it's strictly ran-off donation, obviously that answer is easy. You know, it's very easy. They don't have to answer to anybody.
Right.
So that's another reason why they don't ask for money.
Right.
But that's an easy answer when you're doing the right thing with the money. Easy. Yeah, I'm sure it does. And when it goes to staffing, great. So I'm getting a raise or whatever I'm getting from this money. What am I, the person that's receiving the money, doing to serve the clients? Is there something new I'm supposed to be doing?
That's what I was
Because
talking
this
about,
one's
new
still homeless, and this one got
program.
evicted last week, but I got a raise. But what are we really, you see what I'm saying? Like, it's not working. I think we just need to hold every last one of these people accountable for this money. Don't come waltzing in here just think you're gonna get this money because Evanston got it. Oh, I forgot, we don't have it because there's no affordable housing. That's the other issue.
That's, yeah.
Yeah.
So we don't go there with
We
that
can't.
issue. And then now we have these other persons and families that in need, the migrants that are coming over here. So let's push, just forget about all those vulnerable people, and let's just help them right here. But what happened to them? So now we gotta come up with money for them. But we came up with it. Did we not house them? Are they outside? Do y'all see any of them? I ain't seen nobody outside. Did we not house those migrants that came to Evanston? Yes, we did. Just shushed it. I say I'm having a good problem. Now you see where I'm going with this? I mean, they're coming to every area, and I'm all for that. Please, come on, the more the merrier. I don't have a problem with that. But how in the world did you get a unit with your 16 kids, and I came to a unit with my one? How did that happen? Y'all wanna chime in on this? OGs over there, what? I mean, y'all wanna chime in? I'm telling you what I know. Do you see them outside?
Not at all.
No, you don't. No, you don't. The schools are collecting what for who? But they forgot about the little black kids and the brown kids in your class that need it. And the McKinney-Vento kids that are in your school, but all of a sudden we jumping and running to get some food for somebody, I don't even know who, because we don't see them. You know why? Because they're in the house. Because they're house. They're not insecure. So this is also something to think about, and not saying we gotta be like rude, you know, but we need to just know all this in-between garbage. Look, we don't care about none of that. What are you doing with the money? Directly, is it going, how is it gonna go to Sally Sue over here, who's homeless? Tell me about that part. Not all this other stuff you did before in the past, which you said you did it. How many of them that came for homeless prevention got housed?
Mhm.
Homeless prevention means preventing from being homeless. So let me say, how many that came for homeless prevention got housed, meaning I'm working now, I have kids, I'm ready to have a unit. That's homeless prevention. Did you house them? And then me over here, the homeless prevention, I'm about to get evicted, I owe $3,000, I got all my paperwork,
Mm-hmm,
everything. Did you actually, did y'all pay it, or what did you do? We're not seeing those numbers, I don't see none of that.
So actually, some of the services you're talking about, and I know you know this, but the Emergency Solutions grants are also federal funds.
ESG.
And, yep, 2 of their programs are rapidly housing. And, prevention.
I want you to say the orange family received this and now he's there. The brown family received it, because we use colors, I like to use colors instead of names or X, Y, and all that. And the magenta family got this. You know, like Sunshine family, well, they never turned in none of their paperwork. We don't know what happened to them. We're not responsible for the Sunshine family because they left. We don't know. This one, we couldn't really help the purple family because they didn't have an ID. Well, why didn't y'all help them get an ID? You guys know that you can take the little paper up there to the secretary and say, and get a free ID. Why didn't you do that? I don't understand.
I will do the very best I can to provide report connections. But really, you want me to add some additional?
But I do understand, and we also have to articulate what family means. We have individuals who are quote-unquote family. I had a particular individual that was burned out and received no help,
So,
and had
I should use the term
data.
household, because
Yes,
household covers
household.
one
One,
individual or
thank you.
families. Yes, absolutely.
And you could be a household of one.
Yeah,
You can.
yeah.
Yes, you can.
There's also a difference in the, as far as connection for any other organization of by direct, like, rental assistance, funding, sorry?
I wish they still had that.
But we have Home Depot, we have tenant-based rental.
Oh, they still have it?
Yeah.
I know they still have it.
Yeah.
I can't,
But, like,
there were a couple of things, if you don't mind me saying, a couple of federal regulations that that we're finding very challenging, that we see, and one of the things that is talking to our partners about this, what I mean by that is, so the first challenge with ESG is the, salary, the income of the ESG funds. One of the eligibility requirements is that a household is 3% or below, area median income. That income threshold
It's so hard.
so low. Oftentimes, families or households are having sin before they reach that. During COVID, that threshold was raised to 50. Families that you're talking about are being displaced. They're not below 30%, they're below 80%, below 50%. ESG does have limitations on the number of months of subsidy that can support a household, so it's months of arrears for no more than 24 months, including that 6 months, in a 36-month. So when you mention households hearing that they received some help, now they're no longer eligible, it is a federal requirement. If you reached your 24-month threshold, even if the
And I'm
household is
fine
still in
with that.
crisis.
I'm
still
totally
has to
fine
put
with
in
that.
context.
It's not even that, Sally was in the in program for 24 months with her kids. During that 24 months, what was going on? Like, I really wanna know what was being addressed. The mental health piece is extremely important because we know there's a high rate of mental challenges when you're
Housing
outside.
insecurity, yes, absolutely.
It messes with your mind. It messes everything up. Let's just say that, it messes everything
Your
up.
mind is.
So I would love to know, like, what are you doing in these time periods, like 3 months, and like, what's going on with Family Orange?
Yeah.
Like, I just wanna know how they're being served and how they're being helped. Because in 24 months, I would hope that Family Orange has something. If you're holding their hand, of course, but you can't do that. You can't hold their hand.
I can say that Connection Service Managers are required to meet monthly, at least monthly, with participants receiving help. That's one. And Connection Case Manager budget and financial plans with the goal being stability. Again, we know, like, that's what is supposed to happen, right? So I'm not.
Well, the mandatory classes they take, the money management, which I love her, I can't even think of her name, she's been doing it for years.
Yeah.
Okay, I can take the class, but how am I gonna
But
apply
I have
it?
no money, what difference
I
does
don't
it
have
make?
no credit card. How am I gonna apply it? Well, I'm gonna stay without a job, but thank you for the information. I guess 3 months from now, when I still don't have a job, I just wanna remember and go over and review what you gave me. You think these people are not, of course they know how to say it. Yes, we were iterating the points, I know that. We were iterating the points, we're keeping them up to date on the new stuff that's out here that can keep them afloat or stable or whatever, when you return to the workforce, or to working class society. I understand that. I'm not saying that that's not important, that's not it. But we're taking, you know, as the old people say, cow by the ass. You know, you can't give them all of this, and they don't have a job yet. I mean, we have to address these things slowly and in reality. It's like we're just, I don't know what it is, throwing the services out there, I guess, and to keep doing it for your own job security sometimes too. I'm telling you the truth. Sometimes it's that. Sometimes it is that. And that's okay too. But we're not helping. Not healthy, no. So now, from the 40% Black people, now to 16.5, right? They gone. They're not coming back here. They're long gone, and from 16.7, when I first joined, now it's 16.5. I know I'm a statistic nerd.
No.
So, you know, I find that interesting on the town that I love. Sad, I'm thinking about going to Texas because it's less expensive. You know, and it's sunny, and I'm not, you know, but I love the town that I could take my kids to, and if my kids, like I mentioned here before, if I wanna have my kids take archery, dang it, I could do it here. Whatever they want, they could take it. It's hard to find a town like that, and we could walk everywhere. We have a sophisticated public transit system here. We got the Metro, right, we got taxis, ambulance, we got everything. We got the Northwestern shuttle, you can go around the shuttle, I can hop on it there, not gonna ask me any questions, we don't care. You know what I'm saying, as long as you're within a mile of Northwestern, wherever you're going, it's free. That's pretty dope to me. Can y'all think of other places like that? Like, I'm trying to look for something. I can't
But with
find
all of those
anything.
services, as you've already reported, children of color especially, African American as well as Latinx, so that they aren't seen, basically, for lack of a better term. But none of these services apply to them, that they are entitled to them. There's a major disconnect.
Yes, and the disconnect is what I want to not, you know, that middle carbuncle of crap in there in the middle. I would love that to not be there. I think we can actually do that. I think we can. Now, we're just small fry. But I think it can start with our committee, and then maybe hopefully the other committees follow suit. You know, follow suit. I just think it's important for us to be very careful and very transparent with the people who are coming. And please don't waste our time with all the mess. We wanna hear what's really going on. We wanna hear what our orange and black and blue and whatever families are doing over periods of time, how they're being, because they can be. It takes a lot. It does take a lot. It's literally
Not easy.
trying to lead a horse to water. It literally is a lot of work. I don't know if the case managers don't get paid to work like that, you know.
That's the other piece of it, but I don't know. I'm just, what are your thoughts on that? What are you guys' thoughts? It's been in Evanston for a long time. Like, what do you guys think about that? I'm speaking from, I won't say how many years I've been here, but I'm speaking from a long time being here now. But then I thought, how old am
I grew up here, but I just moved back 4 years. I don't know a lot of the,
I moved all over, and then I've been here 6 years, military, so, not me, family.
I? Right, that's fine.
I agree, though, I always say that, like, if I could ever find an Evanston more warm that I could afford,
Yeah.
I'd be there in a heartbeat,
The
but I,
kids are there, they got tons of, the schools are, man, you could ask for better schools.
it's a, but the problem's affordability, right?
Mm-hmm.
Yeah.
And accessibility, not just affordability, is what I've said before, it's accessibility. And that's why people believe that they aren't seen or heard.
Yes.
Yes, you can help people, but some organizations will send you down to Champaign before they bring you back, all the way back to Evanston to find a room. We don't have SROs. So it's about being not just, I don't know, because and we've had conversations before, I empathize with your frustration. Yes, we need to be transparent with the agencies, but we also expect for them to be extremely transparent with us, which is why I was like, is there a possibility of us reviewing new programs or something that will address some of these other issues? Because many of these programs have been here for a very long time. Is there something that's innovative? Is there something that is trend innovative that is going to spread a wider net to help more people in a shorter amount of time? Are we asking them to be advocates and this new type of advocate that, and it's a big ask, I know that, this new type of advocate that will be innovative to come up with different solutions or best practices that really do one-to-one help of people.
I mean, I feel like those are really great questions. I think those are the types of things that we could say our committee is. We're looking for innovation, we're looking for one-on-one support, we're looking for, you know, direct transparency around what you're doing. They're all really great points.
It is, it does slow the process down.
It does, but if that's
You know
what
what
we
I'm saying?
feel
It
like
does.
we need
Slows it down.
to know that we're doing the right thing, I mean, I think,
I definitely think so. About health and, were you guys ever part of the health and? Okay, so they used to have that when they come back, we vote on the money or whatever, and then the grantees would come back. And a couple months, just give us a little splurge and, give us a little graph of what's going on, and just tell us how the money has helped it. So basically what you're doing with it right now. It helps, it makes you feel a little bit better, about, where the money went. And I'm a fan of, not a fan of these pies and all this. I wanna see exactly what you're doing with it. That doesn't mean I need to see documentation, that's not saying that, it's just. So, right, yeah, exactly. I need to see exactly what Orange Family, where's Orange Family at right now, from 3 months ago? Okay, and who's the new people that came in there and what happened to them? Did it was just an intake process? Did you give them a gift card? Did they need a gas card? Even those little things like that, a lot of people walk into agencies, hey, I really need a gas card. Write that down. If you don't have anything, that's fine, so get it. You know, figure out how to get a set of gift cards there. The intake, make them go through the process for it, because if you need a gas card, there's a reason why. Like,
Yeah.
there's a whole, another reason why. So now you can have open case management. They may not need any, like, direct services or even want it. They just want a gas card. But there's some open case management there where you can call back, hey, is everything okay? You got that gas card? You know, is there anything else we can do for you? And you'd be surprised. You'd be surprised, what people's responses are when they can trust the individual, and you didn't forget about me.
Mm-hmm.
You called me back, like, oh, dang, all that was a gas card, but, you know, so-and-so called me back. Yeah.
I'm thinking about the documentation piece, I mean, you mentioned like, it's a lot of work to provide that, and I agree, and I feel sensitive to that, but and I'm not saying this is the answer, but one idea I have that maybe aligns is, asking them to provide maybe some larger statistics around the successes and the non-successes, and some specific, like, how many families did you not serve, and tell us your worst situation, purple family, whatever.
Can be help.
But also
Right.
your best, so
Yeah.
we get a snapshot, they don't have to tell us
Yeah.
every single family, but it's a way for us to capture what's truly happening in a way that's also sensitive to needs.
And also tells us the barriers, right? Like, what are the needs we aren't filling?
Yeah.
Because
Right.
this is the family
may
we
give
couldn't
us a
serve,
focus.
and
Yep.
here are the 10 things, you know, I'm assuming of what we couldn't meet and why we couldn't serve them, or why we couldn't.
Yeah, a lot of it's paperwork.
Right,
Yeah.
case in point,
A lot of it.
like you said, people should be able to get their, if they are disabled, their identification free. But downstairs, you can only get it if you're 65, whether you're
Yeah, so
disabled or not.
Secretary of State with a letter from a
So that's another buffer, you know.
And then you want birth certificate, I have 6 children. I've been all over the world in that,
Mhm.
and with birth certificate, was always my biggest thing, was the birth certificate, social security card, this, that, it takes a long time to collect those. Yeah. So, when I see baby S is here, I don't care about his social security number. Unknown is what I put down there, because we don't know. I'm not gonna turn away, oh, baby S can't stay with you, but your other 5 kids can, like, that's ridiculous. It doesn't even make any sense. But a lot of times I just ignore the barriers, the couple of little kids that maybe just, wherever their birth certificate is, I don't know. Sometimes the dad is unknown and this and that, so we can't always get every piece of information. I think it is less of a more, not as many barriers these days, I'm thinking, since the, pandemic, it seems like there's not as many now, which is very helpful.
Yeah.
That's a little bit more helpful.
Let's say it that way.
And the repeat offenders is okay. That's where you were saying that mental health piece comes in, for our repeat offenders. Yeah, I used to be a repeat offender, I'm not saying, I got myself together on my own, you know, after constantly just, okay, Renee, this is enough. And luckily for me, I had a grandmother that's really tough, and I'm still scared of her to this day.
That's praying grandma.
Get it together, you know, and I got it together, but it's not easy, you know, it wasn't a very easy thing to, I had to get my head knocked on, you're right. But after you get the therapy and, for whatever reason, you keep not getting your budget together, it makes life a lot easier. You have like that, your support system. A lot of times the case managers don't talk about that. And the only reason, I'm not saying I'm the best case manager out, but the only reason I know that a good support system is important is because of Stacey Marine. She used to always tell me, make sure you have those 1 or 2 people in your corner. So one of my first questions would be, well, who do you call? You don't feel good, like, who are you calling? Who's the person you always talk to? Even if they can't help you by money, they're gonna listen on the phone, because that's helping. So you start to build that base for yourself, and that foundation is very helpful. You'll be surprised. It's very, very helpful. So when you go back into working class society, those same people, they couldn't help you with money, but they'll watch your kids. They might bring some food, might pick your kids up from football practice. Like, they're gonna be there, they're gonna help. And you can pay it forward too. Now, you can do stuff for them and their family, and their kids too. So it's, those minor, small little things make all the difference in the world. All the difference. But it takes a lot of work.
I'm so glad you spoke up, because I feel like it really brought up so many great things for us.
I just have such a hard time, like, because I can't be fake, like, I can't.
We don't want you to be. I'm so glad that you said
I just don't know how to do that.
Yeah.
You know, sit back, I'd rather be quiet than say something that I don't believe in, or agree to something that, you know, yes, like, I can't do it. And I don't want any of us to be that way, to be fooled by these false numbers and whatever else you bring it up. Hard time with it, and it sounds like I'm being crude and mean, or like, it's my money. No, it's not my money, but guess what? It's my money. You know, because if you serve as my folks, you know, we have to take accountability for that. We just need to, I don't know what it is, I just feel like we just need to bear down on these. That's what I'm hearing when they come in here. I mean, you guys you believe it or impressed with it, or, I mean, or you just like, okay, they're in compliance, let's give it to them. They turned in everything. Is it me? Tell me if it's me, because if it's me, tell me, say, Renee, you're doing too much.
I think you have a lot of insider knowledge that I don't have.
Yeah.
I've been speaking for myself. I don't have the knowledge that you have. So I have what's on the paper, and I can assess based on the criteria that we have and what I think of that, but I don't know as much as you. I feel like that's one of the reasons why it's so helpful, what you.
I also think it's okay if we have different
Yeah.
perspectives,
Right, that's
right?
the whole point of having.
I think that's the hope. I mean, actually, better programs are built by diverse perspectives and that discussion.
Yes.
Yeah.
Everybody has a say.
Yeah.
Absolutely.
I think practically, I think of the work of the committee, I think asking these questions of bluntly, what's the money for, what do you use the money, and also for the kind of, feedback of what happens to people who come through your door, how do you deal with them, you know, to get stories beyond the numbers. It's good to know that you dealt with 100 people, but could you give us 3 stories of what happened to 3 of those folks, you know? Dealt with them, where are they now, or whatever. Questions that you were raising.
Good and the bad, right?
Right.
No, I know.
The good and the bad.
Everybody, you know, we just
It's
can't.
those stories, yeah.
Mhm.
I mean, yeah. As an applicant, people who apply, you know, they're under the pressure of only telling
Mhm.
their best
Yeah.
story or trying to
Best
make an
face.
impression, because they're scrambling.
What we want, they think we want.
Yeah, but they're scrambling for that, they're piecing together a budget and spend their lot. And I know what that's like, and you try to play to who's listening to you.
Mhm.
Rarely you find
Authentic.
yeah, well, it's rarely that you find after, I'm speaking from the foundation world, you rarely find somebody who, you know, is wants to hear what you're going through. And they want to hear what will fit well in their report.
That's the perfect word that you said.
Yeah, so,
Yes, from wonderful everywhere. He's out in the community doing stuff. I mean, that's actually just everywhere, literally, in the country sometimes. And what you doing here? He's like, I'm going to the same year as you, I'm shopping. I'm like, okay. I saw him at Babylon one time. What is he doing? You don't even know where Babylon is? The grocery store across from Blake Manor?
Oh, okay,
Yeah.
yeah.
I was like, what are you doing? He's like, I came in to get something to drink from here? Like, you know, just that was funny. That was just funny to me, like, okay, whatever. But we see the work he's doing. I'm not saying that nobody else is doing anything. I was just using him as an example of authenticity.
everywhere.
That's all I'm saying.
You really do.
Family focused, authentic. They can't help but be authentic.
Right.
Because they're always under, you know, authenticity is there. There's probably some other ones, but I don't know. Wheels on Wheels, they just got here, so. I don't know much about them, I just saw they took over Ramsey on Ten.
Right, but well, yeah.
I don't know, they ain't, delivered nothing to my mom, so I don't know. They turned her down because she, I guess her age, she's 93, and she has a certain medical issue with sodium, and she was not gonna say it. Yeah, it was weird, it's some kind of, but anyway, so they ain't delivering her nothing. But, you know, the other thing, I just,
is difficult. And then there are other areas that have no support system, basically.
Yes.
Promises one. And it's like, okay, just $3 million later, you just said you were coming. Where you at?
Like the infant welfare society, they need way more than what they're at, not getting it.
Eventually, ideally, hopefully, going to, information will trickle down to the applications. Will, the way we collect reports and the way we ask agencies with, a summary to, you know, but we create this, I don't want to say one size fits all, but it is, you know, our reporting is the same for all case management. The structure is the same for all social, or for all safety nets. And what we have focused on structure is, the number of participants and how many of those are advocates. It helps with income, age, and special needs, including female head of household, document. For case management specifically, we ask for the number of service plans in the report period, because we want to know, we want to compare that to, like, how many new people are you seeing and how many of those people got service plans. And in the service plans, we want to see how many referrals were made, how many of those referrals, how many services were actually received, how many points of contact agencies, case managers have. And we asked about, and realizing through this conversation that the exit time needs to be retooled so that we're looking at,
Graduation versus,
yeah, so we can suss that out. And the goal really is with that information to be able to get a sense of how many new people are coming in, how many new Evanston residents are coming in, and how many people are leaving. What else is important? What else can I will do a better job of, getting program budget information. Do all of that paperwork and document. So I know where their money is going. I know which staff are being supported. I know how many hours, those staff are dedicating to Evanston residents versus a larger population, and I know it's not, but I'm really, really open to hearing what else, where the gaps are in information. I did make a note to get more specific, issue barriers. We do try to ask about barriers, but maybe I really appreciate it when I ask about what it meant. And committee members shape this up. You know, we're shaping it together. When I think about where we were 7 years ago when I started, it was a very different committee. We weren't asking these questions. We weren't asking, do you do participant surveys? Do participants have a way to provide feedback and how does that impact program? We weren't asking if the staff reflects the population served. We weren't asking if services were offered in Spanish or other languages. So we are making strides, I think, in the right direction, but we're not there yet. There's certainly room to improve. But that is what we're here to. And so I also have in my notes to, you know, come back with more of a report around SG funding.
And FYI, this is no knock against you and your work. You didn't create none of that.
No, we don't.
You know, you didn't create that whole application, I mean, you didn't create that, you know, so I don't want you to think it's.
part of it. I'm not trying to dodge.
No, I don't want you to think.
I asked you to put more stuff on, wait a minute.
Before you even got here, okay, I just making that clear.
It's okay, I
Okay.
appreciate that.
And another thing about the peer stuff, direct services, or you call them services, number of persons served, how do you put that? Okay, so remember that phone call is a service too. So you might wanna differentiate, because
Yeah,
I mean,
in
if you're
person,
calling
phone.
Versus phone.
well, you could do a phone, it take over the phone,
Why is it
and then
in
they
person
could come
versus
in and
phone?
follow
Oh,
through or not. So
With
that's
technology,
a
what are we
point,
looking
that's
at?
a notch. I mean, you put the information and back or whatever they call back again, but that's a notch right there. So sometimes you need to ask, you know, how many of them were phone intakes versus in person, or I don't know if anyone's doing online.
Or telehealth.
Did you have any
session
motel
versus-
stays? It's a big one now. Motel stays is a really big one. That's one that, we can't even keep up with that. Usually we go over the main township. Generally, they always have, like, so just keep in mind of the phone and tele.
But are you saying that that's good or bad?
I think it's good,
Okay,
but, I mean,
so.
but you could say we had 300 people served, but 100 of them were phone calls. I mean, that doesn't mean you served nobody. You did a phone intake,
Yeah,
and you talk to a person, so that is a service. That's a
yeah. Okay.
direct contact. That's
so
a
it's
touch.
good, but it's, from
Right,
a
it's
time
okay.
perspective.
Yes,
Yeah.
I'm just.
What does it develop into?
Yes, thank you.
And
Just keep
that's
that in
something
mind.
that often comes up, and when we're looking at reporting and the numbers, as staff, we try to kind of remind the committee that participants served can have
Mhm.
a different meaning when we're talking about agencies that are providing deeper services
Yeah.
versus more like we're signing you up for benefits, and it's more of a,
Yeah, tax time, help me with the tax paper, you know, it's a lot of that, and even with the application, sometimes you need help with that. I usually did them with them, because some of the questions you don't know how to, you just don't know how to answer them.
Yeah.
That's a service, filling out paper, can you help me with the application, all of those things are service. It's good to know, I mean, some people just might need their resume done, whatever, and hopefully, they have somebody at the agency to do that. Because, you know, they have employment specialists at a lot of these agencies, right?
Mhm.
Okay. So I've tried to take the notes. Video,
Oh my God.
I will document this and come back. I think we do have some, foundational information for a review of priorities. Does that sound fair?
Very fair.
Okay. Well, wait, I'm sorry.
Oh,
So we went through our
no.
feedback discussion.
Yeah,
Is that
that's
okay with
I know.
the, I'm gonna run quickly through our mental health provider program update. Promise. I'll do this quickly. Okay, so this is our timeline. The only reason I wanted to show this timeline to people is because I, originally thought that the mental health provider program would start in early 2023. That did not happen. It really didn't start until the third quarter. Skylight was the first provider, all were able to make referrals and to take referrals. The referrals were slow in coming. The other barrier was it took a while with our legal department to get the service agreements finalized and then to work with the mental health providers to get executed service agreements. We also needed, MOUs for our referring partners. So that was really the first and second. Engagement, we realized that, for populations that like the idea of mental health services, maybe had stigmas around mental health services, so like our youth population who aren't interested in mental health services, we needed an engagement model. Two providers were able to do that, Jocelyn and Skylight. Skylight Skylight started in July, Jocelyn started in September. And now the program really in the last quarter is up and running. So as a reminder, we're working with 4 providers, Skylight, Jocelyn, Met Family, Intact Behavioral Health Partners. Their service agreements are in different amounts of that. Impact is a little bit lower because originally they were not able to provide group services. So they were really slated as a provider of one-on-one service. Skylight is the highest agreement, and that's because their engagement and their group and youth services began in July, whereas Jocelyn, who could provide similar services, like I said, didn't start until September. And Met Family originally was able to provide group off-site, and a change in their policy, they are only able to provide group services in-house, which affects groups that we can run.
Where was that, I apologize, 9 o'clock-ish, Met Family, where were they located? Because I thought that was part of the idea of we were quite interested in that they could be off-site. Where are they?
They're located in Evanston, but we were hoping that they could come, they had historically come to like JEH, to run a parenting fundamentals class. We were hoping that they could run a similar parenting group, either at Family Focus. Okay, so this is just a review of services. The 2 that are new, are travel. We're paying for a little bit of travel for community-based appointments, and then that engagement component, which is quasi-outreach and for specific target. So this chart is a brief overview of the number of households that have been referred, which is different than the number of total people referred. And we can see the individual hours of service provided, the group hours and the engagement hours. Impact, a little bit of a ramp-up time, but they recently, in December, began engagement services with infant welfare. That.
And the other started in September. Or when
Jocelyn did it in September. When did Met Family start?
Met Family, in October, we try to work out some that maybe was. But they are providing individual services.
No, I was gonna let you finish your sentence. This is a question I had at the last meeting. So how do they have 0 engagement hours if they served 8 units total?
They didn't do like outreach, right? Like, they just have referrals.
I don't know.
But yeah, no, that's true. So, the primary referring partner to Met has been Connect. The manager calls Met Family directly and is able to line up appointments. We started that model with all of the providers, and what we found is that a lot of participants weren't following up with appointments and weren't engaging with the providers. So that led to this idea of engagement hours, where we literally have a clinician from Skylight who goes to Gibbs Morrison to hang out with the older kids who go there, and
Like Met chose not to do that?
Met is not.
Bottom line, yes, that looks like a yes.
Yeah. I mean, according, that's what that,
Yes.
that's what 0.
For me,
I
the
mean-
math is not mathing, but go ahead.
Yeah. No, I mean, I think,
I mean, how do you have 6.25 individual hours, 3.5?
Well, they're providing, those hours are the hours of services provided. They need to go on site and meet with the population, serve, to build a connection, to be able to get successful referrals. What this chart is showing is Met Family is getting direct referrals and providing services. So the referrals are made and the person is signing up for the mental health services and following up through and it's happening. In other case, there's a little bit more of a buildup to get to successful service providing. You need to get comfortable first before taking the chance of signing up for the service.
Time span, like
From-
From October to whatever.
So the Skylight started in July, they started seeing participants. That's when I would have to look back, and really started seeing over. So they were doing engagement hours. That's when they started over at Robert. That family, again, once they had an agreement in place, they were able to see referrals. But they just couldn't do groups. And Impact, again, once they had an agreement in place, they were able to take referrals. Let me say that the way the referral process works is, city staff and the agencies, referrals, the agencies that provide have like an intake process. Where when they're working with a participant, they say, if you're interested, if you're interested in counseling services, these are 4 providers you could go see, they look at their services and they're, and participants select the provider. I think that's key in this program, is selecting the provider. So a participant might, and again, I don't know, participants are choosing to go to Met over Impact. They're choosing to go to Skylight over Jocelyn. Not to say that Impact or any of the providers don't provide great services. I don't yet know why they're choosing one over the other.
Or like, if you really only have like barely a quarter of information in a program that's so there's a lot of discovery about like what's working, what's not working. I think talked about doing kind of like targeted engagement on site with an organization, the ones that has been happening focused or into law fairs, to be able to kind of provide awareness of the program and get people comfortable to be like, hey, I want to sign up, this meeting the person that they may get services from as well.
Yeah.
Yeah.
That seems like an avenue that may work in some cases, like definitely is kind of a learning.
providing telehealth.
Yep.
Yeah.
So, wait, I'm just gonna slide on that. This is the race and ethnicity break, participant state. I will get that in. This is a list of participants and their other characteristics. Who came with a document, developmental disability or an IEP. We are serving, a majority of the households served are low income. No, I'm sorry, I will get that breakout of through telehealth.
When I say telehealth, I mean phone or Zoom.
Yeah.
Okay.
Yeah, and there's definitely that option.
Yeah.
I'm not sure.
I think Skylight, I remember Skylight said they do
Yeah.
it. I don't know if they've done it, but I remember in their,
Presentation.
yeah, thank you. I'm,
Sometimes the setup it is practical, but people don't necessarily. I just offer that.
What we're really finding is that agencies that have like parenting groups or the grandparents raising grandchildren, where participants come together, whether it's once a week or once a month, to meet, if the clinician can attend those meetings and sort of, that is what helps
That
get
makes sense.
participants. one of those meetings, I like to take 3 or 4, which is why engagement, which wasn't originally a component of the budget or services, is,
Get paid for now.
yeah,
Yeah, that's great.
yeah, the 3 hours for it. So, and this last slide is, just a breakout of where referrals are coming from. So the light blue is, city staff making referrals to agencies, and the dark blue is our case management partners. Staff includes our adult, managers, our, general assistants and, emergency assistants, case managers, victim our, human services. Also, not our ombudsman, but our, senior care coordinator with community. In, is a person for that? I was just wondering if you knew something I didn't.
No, I thought that position had dissolved after Audrey had had her.
I would say that 96 hour, like if that, the Skylight's 96 group hours, I mean, that's impressive. I mean, I'll just say, I'm pretty impressed by Skylight's numbers there.
During the conversation we had when they first came on.
Well, there were, I mean,
Some
yeah, I mean, there was some hesitation of bringing Skylight on.
yeah.
I don't know, I'm impressed, 96 hours,
That's great too.
I mean,
Sometimes group is hard to get people to do
Yeah.
that, so, yeah.
and I know they've had the longest time, I mean, so I realize that, like, they've had 6 months of it versus, but also that means they got their stuff up and running, they're serving people, I don't know, I like serving people.
Jeremy and I were talking outcomes or metrics that we could take. They're working with a younger population, and it's hard to measure that didn't happen. It didn't happen.
Yeah.
But I did hear very early on that Robert was able to sort of, and after a short period of engagement time, build trust and rapport with the youth. And maybe Danita can come back, although she works with, Brown instead, but, it would certainly.
I would love to see, like, I would love them to come back and tell sort of how this is working. Especially, I would love to hear from Skylight and Jocelyn,
Thank you.
I agree.
personally.
I agree.
Can we talk with them, have them,
Yeah,
yeah.
like, what was working, what did they
What they
learn?
learned, what were some of the best practices they used,
Yeah.
Cause I
that
don't,
might be helpful to.
yeah, cause those are lower, I mean, that referral number's not huge compared to actually,
We've learned a lot with Jocelyn also. They are at Crown working with a much harder population to engage. The staff realized that I learned in working with the Crown team that we weren't quite sure that we were reaching who most needed it. So that was an area of the work that they did.
and is that, when you go, can we go back like 1 slide or 2 slides? That one.
Yeah.
We haven't, we have not paid those, okay, great, thank you.
No,
For
this
service,
is,
right?
this is fee for service, so
That's
that's
what I-
the total amount through the end of 2024.
Can we get a sense
A lot
of,
of those numbers were also driven by the organization capacity, stated capacity. Meaning that they said we could take on X, Y, Z, so their agreement could only go up to the.
yeah. I just wanted to,
Yeah, sure.
yeah. sense of like where are, like, for Skylight and Jocelyn, they've obviously served more. Are we sort of on track for a full year of funding? Are they okay?
We're managing the budget, yeah.
Great, because obviously it looks like maybe.
I
Great,
don't currently expect they're gonna go,
great.
And then,
but, right.
No, I think I found, I mean, there might be some.
We're working on making sure that we get more and more referrals and what works, what doesn't, so like, as we hear maybe the chance to take like action or
Yeah,
change the pilot, because that's what a pilot is meant to do.
Mhm.
So, yeah.
I'm grateful we added that engagement component once we realized we needed it, because it's clearly worked for Skylight and Jocelyn. For the I mean, especially for the youth, that makes sense. You gotta build their trust before you.
can they get, referrals from like? And in fact, the, engagement hours did recently, that's the infant welfare, so we hope that it'll take another in the coming months. Or one service.
Oh, yeah,
Item
that's
of
right.
business, nomination.
Nomination?
Mhm.
Can I make a nomination?
Mhm.
For Amanda Nicole.
Second. Told her I was gonna do that. She knew that from last meeting.
Yeah,
We both, right, we like, it's
you,
you, right? Push this puppy.
We can hold the vote until March, or if both feel.
Is there
We have a quorum. What's up?
Do we have a quorum?
We do, we should vote while we
Let's
can.
vote while we can. I'm not playing with y'all tonight.
Call the vote.
All right, we have a nomination, we call a vote, Jessica, on, Amanda serving as our vice chair?
Aye. Congratulations.
Congrats.
You need me to wrap up. I'd like to keep our leadership in place. Good work, Amanda.
Guys, I'm term limited after this year, so.
Yes.
Yeah.
You're not.
I am.
What do you mean?
I am, and if I'm not.
Surprise.
So Evan's in the bylaws. No, I am. I'm not
Sorry.
termed on the committee, but as chair.
So I said you hit everything, right?
I didn't realize. No.
Okay, so let's see, do we have any?
Oh, any other public comment? Sorry, guys.
Got it, yeah, sweet, yeah.
Sorry I was aggressive with you, I didn't know what you were doing with your phone. I did not know who was the newspaper.
I also included a revised, list of meeting topics, if there
You
are
ran
any
away?
questions, I'm happy to answer.
Wait, say that again, there's an,
Oh, I
A
included in the
revised, yeah.
packet, I didn't address it, I'm sorry, a list of revised meeting topics,
Yeah,
to
up there.
take into consideration for January.
Page 17.
what did I not? Oh, so I did not.
Oh, yeah, I apologize, the only other thing that we had in our
Yeah,
packet,
I didn't, I only
was-
printed out the one memo, I didn't print out that part. Thank you.
right, that's okay, it should, hopefully it's,
You can have mine if
just
you
for
need
notes.
it.
No, I'll find it on mine, I've got it.
Okay, cool.
See page 17.
Our schedule got pushed back a little bit, so I just provided, I updated our topics, I included our canceled meeting in August, and this just lets us know where.
Can always shift, but it's always helpful for the committee to know what they're looking forward. Yeah. Especially when we're at that time.
Yeah. We have deadlines.
Quick reminder.
Yeah, all right. Any further discussion? No. Right, and with that, the Evanston Social Services Committee is adjourned for February. We'll see you in March.
All right, all right, all right.
Thank you, thank you.